Hello, everyone, and we welcome you to this fifth and final day of Baby Communication Week 2026. It's been absolutely fantastic um, week as we have been looking at the theme of seeing the baby and exploring what that means, why that matters, and how we can really do that in practice. Um, so yeah, thank you so much for everyone that's been involved both online and things happening out there in units and clinics and community centres. It's always so wonderful to see everyone getting involved and celebrating and being able to really raise awareness in this area. So as we come to this final conversation this week, I am so thrilled and grateful to be able to welcome Anne-Marie Casey, who's going to have a conversation with me about today's topic, where we are looking at kind of another a challenge perhaps to seeing babies. And today we're looking at seeing babies through experiences of grief, trauma, and uncertainty. So I recognise this is obviously a very sensitive topic, and one that we won't be able to um, cover in its entirety in our short conversation. So this is just really scratching the surface. But yes, a really important topic, and I know Anne-Marie has some really um some really inspiring things to share and some really hopeful things to share. Um but yes, without further ado, I will welcome Anne-Marie, who is a clinical psychologist based in a neonatal team in Dublin. So, Anne-Marie, thank you for joining me.
Oh, thanks for having me, Sarah, and thanks to all the Brazelton community.
It's a pleasure. It really is. If you would be happy, please, yeah, we'd lovely to begin with just a sort of short introduction to get to know you a little bit more and the work that you do with families. And then if you're happy just to open up the topic, maybe you could share a little bit about your work with families experiencing trauma or loss or perhaps perinatal mental health challenges.
Yeah. I guess it's great and very poignant to be here this week for Baby Communication Week. Um, this really brings me back to when I was first introduced to the IMBO and a talk Kevin Nugent gave at the annual conference for the Psychological Society of Ireland here. And he said to us, these babies are the agents of change. And as
Mm.
a clinical psychologist who was working in a mental health setting with adults who were coming in with difficulties during the perinatal period, this really was transformative for me. In my training, I'd been trained to do assessments, formulations, interventions with the adults, but I hadn't fully appreciated, in the attachment, how do I join these two together? So in the neonatal team that I work with currently, unfortunately for the families, these families are crossing an enormous threshold of unexpected crises. So I work on a team where families are coming in, where there's been the experience for the infant of extreme prematurity, the needs, complex medical needs, complex surgical needs, as well as a time of perinatal needs for the parents. So so what we find is when parents are coming in, it's the opposites that are coming in. It's the shock,
Mm.
disbelief, it's the hopes and dreams that have shattered of what they might have wanted for them and for their baby. But also you find parents finding a rhythm,
Mm.
finding a way to keep going, finding a way to champion the small wins And the MBO, is a way of joining families to champion the small wins, to find the ordinary in the extraordinary. And this can really be the start of all that a relational attunement that is needed for a family during this period.
Yes, that's so, yeah, so true. And thank you. And could you share just a few of the kind of maybe some of the settings that you've worked in? Because I know there's been a few over the years.
Yes, so I mean, I've worked across the lifespan
Mm,
during training and post training. So I would have worked from early intervention with the under threes, under fives, right through mental health settings of childhood into adolescence, young adulthood, and into older adults. I've worked in mental health settings with adults and adolescents. I have worked in pediatrics then since 2020, both in cardiology,
yeah.
where you have a high percentage of maybe 500, 600 babies a year that come in with their parents
Mm,
needing interventions for the heart.
mm,
I've worked in pediatric ICU, cystic fibrosis, and
mm,
currently the neonatal team. So quite a broad
mm,
spectrum of settings here in Dublin.
yeah, yeah. Yeah, so many yeah, so many different settings and yeah, just you must have seen so many families yeah, actually having to navigate a real challenge that's perhaps yeah, quite unexpected or something to process. So and that experience for every family is totally different. So
It's
um
really different, and it's so interesting,
yeah.
Sarah, that you say that because
Mm,
one of the phrases that parents often say when I'm at the cot side with them is,
mm,
they describe it as the roller coaster. And, you go
mm,
from ward room to room. It's the commonality of the experience for parents is the roller coaster.
mm,
And, when you think of the threshold for parents and infants, you think of the biological changes, the environmental changes, the social, the emotional, and you add in kind of medical complexity into that. You know, it's a huge crossroads for families. So it's understandable that, the international research would suggest that it's 1 in 5 women, 1 in 10 men who can experience perinatal mental health difficulties. And that's compounded with an increased risk for those who have an infant needing a NICU or a
mm,
pediatric NICU admission.
yeah,
So the stakes are high. You add
yeah,
in homelessness, minority groupings, anything into that, and that, increases the risk factors again.
mm,
So all the time we're cognizant of the risk factors, but also the protective factors. So what is it that we can use to help mitigate this trauma?
yeah,
What is it that we can do to sort of scaffold the experience for parent and infants to join together in
mm,
this moment?
yeah, yeah. Thank you. So, before we look at perhaps some of the ways that we can help support the baby to be seen and the beginnings of connections for these families, um, I first wanted to ask your thoughts about when a parent or parents are navigating experiences such as a previous baby loss, perhaps birth trauma, perinatal mental health difficulties, or any other kind of overwhelming experiences. How can these things actually affect and challenge their ability to see and connect with their baby?
Absolutely. So, I mean, all of what you have described there, let alone a previous mental health history,
Mm,
it sort of puts the nervous system on a high alert. So it makes the parent feel and puts them in survival mode. Now, of course,
mm,
the survival mode of our brain is protective. It's protective in scenarios of threat to stay safe. But also unintentionally, what that can do is if we're looking out for threat all the time, we're almost like on a time machine where we're looking at the what ifs and in the future or past regrets. But of course, it's taking us from this moment. And this moment, as Kevin Nugent would say, is a moment par excellence to
mm,
join,
yeah,
for a parent and infant to join together.
mm,
So what happens is the nervous system, it almost puts a blur on the lens of a parent to be able to see and join their baby in this moment without the maybe attachment, misinterpretations, oh, my baby's crying all the time. Maybe my baby doesn't love me. Maybe I'm not a good enough parent. Maybe my best friend would be a better parent than me. So it leads to all these kind of cognitive distortions, if you will, misinterpretations, and just
mm,
that blurred lens can really interfere with you seeing this baby
mm,
in front of you, and also may block that ability to kind of ground yourself and
mm,
see that, oh, these thoughts, they're just random thoughts. They're thoughts like, I'd like my dinner, but of course I'm not going to have my dinner because it's 11 o'clock in the morning,
mm,
for
mm,
example. But sometimes we can get hooked into some of these thoughts, which can negatively reinforce these patterns at a junction where
mm,
there's so much happening for
mm,
parents and infants that we have outlined
yeah.
already.
Thank you. Yes, no, that uh, really sort of paints that picture of the just um, emotional overwhelm
Mm.
and yeah, as you said, the sort of survival mode that these parents are in at this time. So um, with these kind of feelings of maybe disconnect or um parents maybe feeling like they're going through the motions. And I think you touched on this that these can bring really huge feelings of guilt. Um, how can we how can we begin to help parents understand that these experiences with compassion rather than with judgment, those feelings that they're having?
Yeah, so I mean, this is such a great point, and compassion focused therapy really looks at this in depth. But what we'd always start with as a psychologist is starting with the formulation. So it isn't just a list of events or a timeline, but
Mm,
it's understanding why is somebody experiencing what they're experiencing
mm,
at this time.
mm,
So we start with a formulation, which is a joint formulation of understanding the experiences that are happening and the impact that's having,
mm,
while also acknowledging what are the protective factors, what are the glimmers, what's the potential for this family to be supported at this time.
mm,
Now, often in the flows of compassion, we can be quite good, quite equipped to acknowledge the needs of others and to respond to other people's needs. It
mm,
can be a little bit harder to be open to receiving the care from others. But
yeah.
often one of the big blocks can be the self to self compassion. So
Mm,
allowing ourselves to self regulate, to go out and meet the needs of others. So shame is one of the big barriers that can get in the way with those flows of compassion. So
mm,
again, it's sort of acknowledging that, but one is awareness, and another important part of this is to give ourselves permission to move past these shame experiences, these
yeah.
guilt thoughts, understanding, my goodness, My
Mm,
body and brain have been through so much. Here is my baby here in front of me. Of course, it's understandable I'm having these experiences.
mm,
And also that connection isn't perfection.
mm,
We're not striving for a perfect scenario. It's good enough parenting. The outcomes are that if you're good enough 30% of the time, you'll have great outcomes with
mm,
your kids. So this alone can be quite validating. But sometimes it's saying hello to that critic that might be sitting on your shoulder, you know, hello to that emotion, but knowing that that emotion and that thought, it isn't your parenting identity.
mhm,
There's some sort of communication with yourself that's, oh, hello, something is happening for me. This might be difficult, this might be overwhelming, just as you said,
mm,
Sarah.
yeah,
And the NBO can definitely be a vehicle to
mm,
show parents, when they're numbed and a little bit shut down, oh, look at my baby, look at what they're doing, look at the strengths of it, because we mightn't be able to see those things when the lens is blurred.
absolutely. Yeah, I think, as you said, it's just so important that these kind of responses are normalized for parents, and that they understand that that's the way that their mind and their body is kind of trying to cope. So it's uh, yes, having that compassion for them. Um, so I really wanted to just make a point of that first before we kind of uh, go into thinking more about um yeah, seeing the baby and beginning to connect with the baby, because yes, this is a slow process, and a process that's different for every family, and always needs to sit alongside that compassionate care, and small steps. But if we start to think about um ways that we can gently start bringing the baby into focus in these difficult circumstances. Maybe you could share with us some of the ways that that could look like in practice. And you've already mentioned the newborn behavioural observations, the MBO tool. How can approaches like that help to um, yeah, gently bring the baby into focus and help create a safe way back to noticing and connecting with the baby?
Yeah. And I think you've touched on that, Sarah. It is something about slowing the whole process down to have the invite to join in this moment. Can be so important. We talk about that mindfulness, but the slowing down to join can be the hardest part of that of that journey to have a moment of meeting. And there's no one intervention. It is a toolkit that we have alongside EMDR, alongside CFT, alongside video interactive guidance to do these shared observations and moments of meeting with parents and infants. But I do find that the MBO, when I'm coming to meet with families, and only last week there was a mother that I saw in the unit, and this is what I find daily is you bring along the MBO or your more informed care, and you do these shared observations with a parent, and you watch and see and ask them, what did you notice about your baby here? What did you notice about their skin color? What did you notice they were telling you when they looked away, but when we waited that little bit longer, they looked back? What was that like for you? What did you see your baby doing? And there's always this moment, the baby is revealed, the relationship is revealed. some of the wounds of the trauma of perinatal mental health difficulties means that the parent can feel displaced, sort of less needed, maybe less able to comfort their baby, not feeling good enough, And in our pediatrics setting, you'll have parents say, "Oh, I'm not a surgeon, I'm not a nurse, I don't know how to feed my baby. I'm not an NG tube, for example."
Mm,
So this MBO invite is like, oh my goodness, I do matter. I can see my baby has a preference for my face. I've seen my baby follow my voice. I've seen my baby have a preference for my voice over the rattle. I've seen
mm,
my baby who has a developmental delay just needing an
mm,
extra few seconds. But of
mm,
course, if we are speeding up, you know, parents might not get to see these moments where the baby has an initiative
yeah.
and there's a joining together. So the NBO is a way of restoring some of the self-efficacy, which I think is just so important for parents.
Mm,
So it's self-efficacy, it's agency, it's control, it's empowering, you know, the parent to see I matter, my relationship matters, my infant knows me, my infant can see me, and I can see them. So, the baby's behavior is its communication, but the MBO is able to reveal the most subtle of
mm,
cues that this baby has an intentionality, that
mm,
this relationship really matters,
mm.
and it's just so powerful in the moment. It is the extraordinary in the ordinary. It's
Yes,
such a simple
yeah.
tool, but it's like the layering complexity of how
Mm,
it can feel in a room with the
mm,
parent and infant. It's a bit of magic, I think.
mm. Yeah, absolutely. I mean, I wonder if you, yeah, have any, um, yeah, sort of short kind of stories to give an example of how you've seen that firsthand, perhaps with a family who's, uh, yeah, been going through some form of trauma.
Yeah, so again, I mean, anytime I introduce the MBO in a session, you know, it's almost like you can feel something has melted away. So a barrier has melted away, that it has allowed the parent's nervous system to reset, give a little pause to be able to meet a baby
Mm,
in this moment. Um, I recently had a family where a little infant was very poorly, quite fragile medically. Um, and we were going through the some of the MBO that was appropriate for this little baby. And as soon as so this baby was crying, looking at consolability, and the I won't say which family member, but there was a family member in, and the dad came along, and next thing the dad said hello to this little baby, and the little baby just immediately calmed, like the consolability of hearing his
mm,
dad's voice. And the other thing that's quite magical is the narrative and the reshaping of the narrative. So this dad was saying, I do notice I have this effect on my baby.
mm,
I do notice how much comfort my baby gets from even hearing my voice.
mm, mm,
Um, so all the time it just gives a lot of permission for parents to be parents
mm,
in a situation, particularly in a pediatric NICU, where there's separation, where there's medical interventions, where there's, the stakes are high for these infants, but it gives really the invite for a parent to notice, oh my goodness, my baby has been consoled with my voice.
mm,
I matter as much as this NG tube. I matter as much as this stoma bag. You know, I am needed
mm,
in this moment. So, whether it's the little red ball and tracking, and sometimes in the tracking, because there's so much going on for the babies, the sensory overload, what they need when they're born early, their brains are born early, the parents' brains are born early too. So tracking a red ball, waiting for an infant, and watching and waiting them track back. When a parent can see, and I've seen it so many times, when a parent can see, oh my goodness, I can see a strength in my baby. You know, again, it's like it's like metaphorically giving the baby into the arms of the parent. They can see their
Mm.
infant.
Yeah.
Yeah.
Um, One other area I just wanted to ask if you had any um thoughts about or experiences of was yeah, families who had perhaps lost a baby previously, and that experience of the new baby that they have, and um kind of the journey to connecting with this new baby whilst holding the kind of experience and the trauma that has come previously, and yeah, again, how can we sort of, in that kind of situation, how can we help parents to begin to see the baby that's in front of them and who's an individual
Mm.
themselves?
Yes, and I guess there's so many different experiences with baby loss. Um, and you can get grief experiences, complicated grief experiences, the multiples when there's been a difficult journey towards the following birth, whether it's been an IVF journey, multiple miscarriages. There's so many layerings to that. Have parents had an opportunity to grieve the baby, imagined and real, and what has this pregnancy meant? So, of course, you think about the journey antenatally for those parents as well. Like, what has that been like? How protected have they been? And and as a psychologist, we would spend a lot of time with parents to see, is there a separation between the previous baby loss and this baby? And you know kind of untangling that through assessment and formulation. But the MBO, I find, provides a bridge to this new baby. So again, it's holding. We don't want to forget about this baby who meant the world to us and, gave us so much meaning to become parents.
Mm.
And how can I also recognize this relationship in the here and now and bring curiosity to them being their own person?
Mm.
So the strengths orientated part of the MBO really helps with the individuality of this baby here in front and wondering, who is this baby? What are they feeling? Now, I often find with parents is you know that there's a certain process in the meaning making where you know maybe a robin appears at a window, maybe it's a white flower has come to blossom, a white thorn out, at the time of conception of the baby, or something that is like, oh, here's a message from my previous baby. Here's a message from this person who is important, but not in this world in this way anymore, that tells us they're here. So for parents, there's a journey to how to accommodate the loss and enter into this new relationship and holding both. But sometimes, it's the art and science of what we do is, when parents mention the robin who's appeared or whatever the sign is from the universe that this person is present, while being able to accommodate and make room for this person to be able to join them. It's a remarkable journey of, it's intentional relational, it's an intentional relational journey to make room for a new baby while acknowledging the loss
Yeah.
of somebody
Yeah.
very special to them.
Yeah. Yeah. Thank you. That's, yeah, so beautifully and sensitively um put. So thank you. Um well, I think we're, yeah, coming to the end of the things that I wanted to ask you about and talk with you about. And I know there really is so much more that could be said, and yeah, this is a big topic. But I wondered, yeah, as we sort of come to a close, um, if there was any kind of final reflections that you would like to share, or perhaps something that you um, hope that practitioners and parents would remember about um, truly seeing the baby through uh, trauma and loss, and other uncertainties and challenges.
Yeah, so I guess for all of us, it's it's the whole family experience, while keeping the infant in mind, it's
Yeah.
keeping the family and the whole systems, all of those phrases, it takes a village,
Mm,
Bulby, if a community values its children, it cherishes its parents,
mm,
all of those phrases, they really resonate. So for staff and practitioners, it is how to keep the whole village in mind, and for parents to know,
mm,
I think connection is not perfection. It's in, there's no such thing as synchrony. A parent synchronizes a baby synchronizes an infant,
mm,
but that isn't a one state. It's a regulating state. So the more we can regulate ourselves as a staff and a practitioner,
mm,
the more helpful it will be when we join families and when we invite the parent to
mm,
pace, to steady, to slow down, to have a metaphorical sugary cup of tea, to be able to meet the baby's needs. All these small steps and
yeah.
small glimmers really are a great start to something positive,
Yeah.
and that hope that's there for every family that we meet, that it's good enough every single moment,
Mm,
but to slow it down, to
mm,
be able to join in those moments.
mm. Thank you. Yeah, that is really so inspiring to hear you say, and I think it's empowering for for professionals who are working with families to, know that there are, that, yeah, they have um the ability to bring these moments of hope and healing, and yeah, there are tools and approaches out there to help with that. But I think, yeah, really importantly, um being able to help, even just one small thing to help a parent see their baby, and that can be such a, we talked about using the MBO, and it's something that's so gentle, and it's just showing or looking at the baby together, but actually can sometimes, that's when things maybe can start to turn a corner.
I know, because
So
it's like a moment to enjoy your
mm,
baby,
yeah, yeah.
And if you've enjoyed something, that's a glimmer of hope.
Absolutely.
you know.
Yeah. Well, thank you so much, Anne-Marie. It's been such a pleasure to talk with you, and yeah, hear your wisdom and your experiences. And yeah, we really hope that everyone that's listened to this conversation has, yeah, found something to kind of take away and ponder more, maybe something that sort of inspired you. And yeah, if you're new to the Brazelton approach and the EMBO, then do come and find out more. Come and connect with us, and we'd love to. Um, yeah, we'd love to let you know more about that training, and yeah, how you can use it in your particular role. And hopefully you've seen, if you've been following the week, across Baby Communication Week, we've looked at lots of different areas that the Brazelton approach can be used in, lots of different settings and situations, from kind of universal universal care like health visiting and midwifery, but also in more kind of targeted, and as an intervention in different situations with families. So that's really one of the beauties of this approach, is its flexibility, and it can be used by really by anyone who's working with families, because it's all about giving the baby a voice. So I think we will end there, but I just want to, yeah, thank Anne Marie once again. And yeah, do continue to follow us and connect with us at the Brazelton Centre. And yeah, we thank you for joining us today.
Thank you.